Hi, my name is Ashley Randall, and I'm an 8th semester nursing student, and I will be doing my trach video today. First, I will perform hand hygiene and introduce myself to my patient. Hi, my name is Ashley. I'm going to be your nurse today. Can I get your name and date of birth? Compared to the armband and provide patient privacy. I'll explain the procedure to my patient. Hi, we're going to section out your trach today and clean it. Do you have any questions? No? Okay, thank you. Make sure there was a towel so that if it gets messy, it doesn't get on the gown and the towel catches it. And while I am sectioning, will you please raise your left hand if you are having any difficulty breathing? Thank you. I will hyperoxygenate my patient, and I will turn the section on to continuous, anywhere in the 80 to 120 range. And first I will section. And my glove just rolled, so in the hospital setting, I would go ahead and redo this, but for this, I am not. Same with this one, it just rolled. So I will take this into my dominant hand. Alright, and now I will take the oxygen off, and this hand is no longer sterile, and I will connect it to and make sure that the suction is working. Alright, so first I'll get it wet, make sure the suction works. Alright, I'm going to insert this in your trach, until make sure the suction's not on until I meet resistance. And then once I do, pull it out, intermittent sectioning it for 10 to 15 seconds, and I will repeat this until there is no more mucus or phlegm and it is all cleared out. And then I will also suction more to make sure this is all cleaned out. And once I'm done with that, put this back on my patient while I'm getting everything ready. Hand hygiene. that glove rolled again, so I would have changed it. And now I can set up my stuff. I will put saline in both compartments. Sterile saline in both compartments. That is no longer. Put peroxide in one of them. And with that tipping over, I would have went ahead and got a new kit, because that would have made this non-sterile. Alright. So this hand becomes dirty, and I'll take this inner cannula out and the pipette. I'll put that in there and I will let it soak, let it break down all the mucus and phlegm. Alright, then once it's soaked a little bit, I'll bring it over a trash can just so I don't get my sterile field dirty. And clean all the way in it and on the outside. And then drop it into the just clean water, or the sterile water. And then once that's rinsed off, I will put this back in. Make sure you hear the click. Alright, and then with my dirty hand, I'm going to take this out. And I'm just going to clean around, assessing the skin underneath for any pressure wounds or any skin breakdown. And once that is clean, I would go ahead and put on new sterile gloves so that I can change the V dressing. And I would perform hand hygiene in between, but for the video purposes, I won't. So at the moment, both of these are sterile. At this point, I can take off my sterile gloves, hand hygiene, and I can just put on clean gloves to change the necktie. Usually you would see if you can find somebody to help you with this, to hold the cannula in place, but with it being just me, I will make sure I have one hand on the cannula at all times until there's a necktie secured around it. And I will make sure that there's room for at least 2 fingers, but not too much room to where it can pop out. And if it were to pop out, there's always an obturator on the side of the bed or on the wall. And then you will put the oxygen back on once you are finished and bring them back down to what they were before. And you would reassess the patient and listen to the lung sounds and make sure that it has improved. If not, then you probably do need to suction more. And that is my video.